Some of the changes that happened at Waddlers came about because when Westwood had closed, Westwood had had a dental department, and it had had a lot of clinics run at Westwood. And obviously when people left Westwood and moved out into their own homes or moved into other residential or nursing home accommodation, the expectation was that they would access generic community services, i.e. go to your local dentist. At that, when I was at Waddyloves at 1994, it became apparent that we were getting lots of requests into the trust, that the community trust that I worked in, that the community dental service was getting lots of referrals from generic dentists to say that they couldn't meet the needs of their population, and i.e. they didn't have accessibility. In other words, they couldn't actually physically get into the building, or they wasn't compliant in sitting in a chair and having dental treatment or even having an inspection, or so they were referring a lot of their patients to the community dental service. So the community dental service was getting lots and lots of referrals for people with learning disabilities, saying that they were unable to meet their needs in the generic community. So the manager at the time, the big managers at the time at the trust was working with the community dental service to say, how can we help with this? And obviously it became apparent that we had a lot of expertise and a lot of people who were very experienced in working with people with learning disabilities accessing healthcare, and it was decided to set up a clinic at Waddyloves, and it was set up as a dental clinic and a podiatry clinic, that's chiropody, because they were getting lots of referrals from generic services to say, help, we don't know what to do, we don't know how to meet the needs of people that are coming to us. And it was set up on the premise that we would give people longer appointment times. In other words, people were not expected to walk in and sit in a chair and have their mouth examined straight away. They were allowed to come in, and it was a pleasant environment. So people came, they could have a coffee, they could have a wander about, they could go to the toilet, and it was all done at that person's pace. And it was also understood by the dentist and that I worked with that we would do lots of familiarisation. In other words, they could come and have a coffee and meet us and say hello, meet the dentist in the waiting room. We didn't wear uniforms, we didn't wear a white coat, we didn't wear anything that was scary, because for lots of people it was to go to a generic dental service was becoming scary, because they have limited time to meet your needs, so therefore you've got maybe a 10-minute appointment. In other words, you have to walk in, you have to give your name, you have to go and sit in the chair, and you have to have a dental examination, all done within 10 minutes, which is very quick and but if you understand what's happening, then that's okay. But if you're a bit scared or a bit nervous, or you've had a bad experience in the past, then it has to go at your pace. And that's what we set up at Waddyloves, is that the dental service were for people who, for whatever reason, could not access ordinary dental services. And we had lots of people who came to Waddyloves who only came to sit in the waiting room, have a coffee and have a pleasant time, meet the dentist, say hello. She came out to meet everybody. Second time they came, she may have a toothbrush and she may say, I'm a dentist, this is what I do, how do you clean your teeth? And it was all at that person's pace rather than any expectations. And to be honest, we met lots of people with really with mouths that were very we had decaying teeth in, they had lots of plaque, they were dirty, they were not cleaned very well, and people must have been in pain, people with abscesses and things. But because they couldn't access the service, it became so that, it became harder for people to get the dental care that they needed. So on the other side of it was the podiatries, that people in generic services were saying that they needed longer times in the clinic areas. If you get, I think it's something like 8 minutes you had in generic services to walk in, take your shoes and socks off, get in a chair and have your feet attended to, and then you were out and about. And you could only be seen every 16 weeks. Whereas a lot of people that we met needed longer times than that to be able to, they needed some support to get the shoes and socks off, they needed help to get into the chair, they may only have one toenail cut the first time they came, but we were free and able to offer them more and more appointments so that they could get used to the service, so they could get used to what was happening. And we also offered a service for people who had difficulty cutting their fingernails because they were very, very thick. People that we know who had calluses and things on their feet, very hard skin. We could do it at their pace rather than what was expected out in the community. On top of that, then we found out when we did a lot of more research is that people's eyes and ears were also people not getting the examinations that they needed. So we also set up a service with an orthoptist and an audiologist who came and did hearing tests, and the orthoptist went out to visit people in their own homes or offered clinic appointments at Waddyloves, which were longer appointments. It was a lot more relaxed environment. You didn't walk in and have to put your chin onto a machine and have your eyes looked at straight away. We could do things on a lot more low key. Went into the day services and spoke to the day service staff about why it was important that people had. We did a lot of education. We did courses for people to learn why you need to look after you. People with learning disabilities had a course run by a dentist and myself about why it was important to keep your teeth clean and how to do it, and the kind of food that's better for you than compared to food that's not good for you. We also run education sessions for staff on how to keep people's teeth clean, what to look out for, how to brush a person's teeth, why it's important that you need to brush teeth. I mean, there were lots of myths about people would come and say, so-and-so hasn't got any teeth, why does she have to have a mouth examined? So we did lots of education to staff about why it was important. It was just coming to a level then where people were beginning to recognise across England and Wales and Scotland is that people's health and people with learning disabilities was not good, and it needed more attention. So those are the clinics we set up at Waddyloves at that time. We also then set up, we had a generic general nurse that came in and did some health screening, general screening of people. We ran sessions with nurses about ladies who needed smears. We did work with the family planning service about how to help people with learning disabilities access their services. So that's when we changed to a lot of health. We're still running the day service, but we're also focusing a lot on health as well at the time.
Mm-hmm.